at our last large surge of 102 to potentially 600 by mid-January is very concerning. Again, we have wonderful hospital systems and wonderful hospitals, each of them working so very hard to care for all the individuals that have been cared for and are continuing to be cared for. But they can't sustain this level of increase. It's already straining the system to go from the high of 100 to over 300 currently. But just imagine for them to be able to treat over 600 individuals as is the projection. That is an alarming number, and we need to turn things around. I know we're tired of all the recommendations about staying home, washing your hands, socially distancing, wearing your face covering when in the proximity of someone else, but we need to continue to do that. We need to specifically abide by the current stay-at-home order. It calls for you to do just that, and it calls for me to do that. Stay at home as much as possible. When we need to go outside, when we need to go to a store, and when we need to visit a business and give them our business, please do it in a limited way, do it in a very safe way, in a quick way, and return home. And again, returning home, though, doesn't mean that you have to be holed up, locked up in your house, in your room. It means stay within your household, in your home. Go outside, if you have a yard, do gardening, go outside to take a walk, go to the park, but minimize all unnecessary contact with others. And it's really only those things that are going to help curb this projection of over 600 in the hospital. And it's as Supervisor Parks, this holiday season is very challenging because we all would want to finally have a get-together for the traditional holiday festivities, but it's still not the time. Please do all that you can to limit any gathering, and be safe, stay healthy, because as these numbers indicate, this is a very serious situation that we're facing, not only in Ventura County. Clearly, this is not specific to Ventura County. Our sister counties up the north and down the south are experiencing a similar surge, and in some cases, their rates are even higher than our county. With regard to the vaccine, I think I have a few slides on that. Well, before I go to the vaccine, just you're familiar with this dashboard. I won't go into it in much detail other than to alert you that it is updated on our website. And it does show that our case rate continues to increase from even the last week. This is current information as of yesterday by the state. On Tuesdays, they update these numbers. You see our case rate adjusted is 41. Our unadjusted case rate, if it was not adjusted for the good test volume, it would be around 70. We need to have it less than 7. So clearly we're way over what we need to do in order to start reopening and get back to the tier-phased approach to opening businesses in other sectors. Our positivity numbers also show a jump. You see there 12.6 for the general population and almost 17 for the low-income, high-density communities that correspond to the health equity HPI metric. Our hospital capacity is officially listed as 0, but that's also with an adjustment factor downward for having a significant percent of individuals in our ICU that are positive for COVID. Our testing volume is good. Other counties are also doing good amount of testing. So we're testing at a rate of 722 Ventura County residents on average per day for every 100,000 resident. So now in terms of the vaccine. So more information will be shared in the coming days and weeks about vaccine and the priority groups. But I wanted to assure you that our Department of Public Health, along with other departments, and soon will be expanding our task force to include other stakeholders out in the community are working hard to plan for the distribution of the vaccine that our department is getting directly, and to work closely with those facilities such as hospitals and others that will be receiving the vaccine directly. Overall, we're in the very early stages of the vaccine distribution. We're in alignment with the state and federal authorities that have the rollout of the vaccine in what they call phases and tiers. We're in phase 1A that addresses the first priority group to be healthcare personnel and long-term care facility staff and residents. That is the first priority, and that's who first received the vaccine. And the hospitals are vaccinating their staff. The long-term care facilities are working with contracted pharmacy companies that the state arranged, and they're getting their staff and their residents vaccinated. That is the current phase 1A, tier 1. And here on your screen, you'll see that tier 1 is the acute care, psychiatric, and correctional facility hospitals, skilled nursing facilities, and after those two groups were the first priority within the tier 1, now we're moving next week into the subcategory of tier 1, which is paramedics and others providing emergency medical services. We're also going to be reaching out to dialysis center staff and vaccinating those workers next week. Upcoming tiers is 2 additional ones, tier 2 and 3. That's all still within phase 1A. Again, phase 1A has to do with healthcare sector and long-term care facility sector. In tier 2, we're expanding outward to now be intermediate care facilities versus the skilled nursing facilities, home health care, support services, others that include community health workers, public health staff providing direct services, behavioral health providing direct services, social workers, and others that are, again, providing direct services will be in tier 2 and in the coming weeks. Also, one other important group within this tier includes primary care clinics, and certainly that includes our federally qualified health centers operated out of our ambulatory care clinic system, and also Clínicas del Camino Real system that has federally qualified health centers. That's coming up in the next few weeks. Tier 3, within phase 1 again, is other settings of healthcare workers, specialty clinics, our lab staff, dental offices, and pharmacy staff not working in the setting in the other tiers. So as you can see, again, even with these tiers, they all relate still to the healthcare sector and the long-term care facility sector, and those providing direct services within those sectors. There are going to be other phases, and here's a recap of those other phases that are coming down the line. How soon we can move into each of these additional phases all depends on how much vaccine we get each week. We're getting shipments each week, but they're still in fairly small quantities, so we're moving group by group, priority population by priority population, making our way to when we get enough vaccine for public access for the general audience of Ventura County residents to be able to get the vaccine. We're still quite a ways from that. It could be 2-3 months. So with more reason, please do all that you can to flatten the curve. Know that there is light at the end of the tunnel with regard to vaccine. But as you can see from this slide, there are still other priority groups after the current one before it is generally available to the general public. Okay. So with that, I'll conclude my report for today and introduce to you Dr. Kathleen Shore. She's a hospitalist at VCMC, and as soon as I clean here, she'll be up next. Thank you.
Hi there, thank you for having me today. I really appreciate being here and getting an opportunity to tell you a little bit about my experiences with the coronavirus. I, of course, am a person just like you guys, in addition to being a physician, and I've had to adhere to all the social distancing guidelines that we all have, and I understand that people are getting tired of these things. But I also understand all of the facts and figures that Rigoberto Vargas just told us. And the number of 600 patients in the hospital next month is absolutely going to be devastating. Our system currently is overwhelmed. We are overworked. We are all doing extra shifts at the hospital to try to take care of the surge that we're in right now. And if this surge continues to heighten and grow, we are in trouble. We need your help at the hospital. We need there to be fewer patients coming to us with coronavirus. And not just fewer patients coming to us, we just need there to be fewer coronavirus cases. It's really tough to have to spread our staff so thin. I can remember back in July walking into the hospital after I hadn't been on for a few weeks, and I came in and I looked at the faces of my nurses, and that was our mini surge compared to now. And our nurses were just downtrodden and tired and frustrated and overwhelmed with all of the PPE and difficulties of caring for a patient with coronavirus. And if that's true in July, when we had maybe 70 patients in the county with coronavirus, and now we have 300 and something, and in January if we have 600, wow, I just don't know how we're going to sustain that. That will be, hopefully we never have to find out. Hopefully everybody is going to pull together and come together like the community that we are. You know, I was here for the Thomas Fire. I'm sure a lot of you watching today were here for the Thomas Fire, and I felt that that was an amazing outpouring of community support and outpouring of love for each other. I would love, speaking of love, I would love to see everybody come together like we did for the Thomas Fire. It is time. We did a great job back in March. Do you remember when the roads were empty and everybody was staying home and we didn't have coronavirus? It didn't take off here. And the reason it didn't take off is because we all did a great job back in March and April. It's not till really recently that things have gotten out of control. And the vaccine is on the horizon, but the vaccine is not going to come to you tomorrow. We have months of this in ahead of us, and we've got to tamp it down, and we need your help. I need your help. I need you to wear a mask. I need you to not gather for Christmas and for any other holiday celebration for that matter. I need you to stay apart from each other and just stay home, please. I have so many stories of patients, young. I had a very young man who was a manual laborer, very fit, healthy guy in the hospital, and he couldn't breathe. And that was terrible. He had gone out to a bar not long before coming in with coronavirus. And I can tell you that he was very disappointed that he had done that. He was disappointed in himself. He said, God, if I'd only known. And I said, well, you kind of knew, we'd all been telling you, wear a mask, don't go out, don't socialize. And I was nicer to him than that. But he knew that. He knew that he kind of did this to himself, and he felt very bad about it. Another story. Just today I was talking to a patient, and he said, Doc, he was an outpatient of mine. He said, I had coronavirus. I had it a couple of weeks ago. And he said, and I feel I did okay with it. He said, luckily I've gotten my health in order, and I'm doing pretty well. He said, but I passed it to several of my family members. And one of those family members is in the ICU right now. And I have to tell you, he didn't feel very good about that. And I wouldn't feel very good about that. I don't love all this. I didn't love it when I was going to my parents' house for a socially distanced visit. And my 3-year-old looks up at me with her very cute eyes and says, "I know, Mama, I can't hug Grandpa Mike." And I said, "Oh, that's so heartbreaking. I hate that my 3-year-old can't hug my dad. But I would hate it even more if I knew that my family passed the coronavirus to my mom or to my dad. That would be really difficult to deal with. That would be really devastating. And so I need you all to heed the words and the thoughts and the wisdom that my patients that have had coronavirus have come to. You know, there's a lot of information out there. Oh, maybe this is a hoax. Maybe there's not so many patients. I can guarantee you that it is not a hoax. There are real people suffering from coronavirus, and it is not fun. It is devastating. You know, 210 of our county members have died from this. These are your neighbors. These are your friends. So I really want you to tone it down and just stay the course. We've got to stay separate from each other for a little longer. We do have that light at the end of the tunnel with our vaccines coming on board. But we're not going to realize the benefit of that for a while to come now. That's going to be a while till the population calms down with that. And so we've got to keep doing all the things we know that are going to keep the virus under control. It's really important. My fellow doctors and my nurses and all of the other support staff at the hospital, we're counting on you to make a difference. You don't have to get together in large numbers for the holiday. Please just keep to yourselves and find new ways to enjoy the holiday. Thank you. I'd like to introduce our next speaker. That is Darren Lee, President and CEO, St. John's Pleasant Valley and St. John's Regional Medical Center and Dignity Health. Thank you very much. Enjoy the holidays.
Thank you, Dr. Shore. I really appreciate your comments and echo your sentiments. I'd like to begin by thanking the county leadership for their support throughout this pandemic, the coordination they have provided, as well as the communication and resources has been invaluable. I'd like to personally thank the Board of Supervisors and Mike Powers for their support of the funding that they have provided to the nonprofit hospitals in our county to help mitigate the costs of caring and fighting COVID-19. I want to give you a little bit of insight into what we're experiencing at the hospital. We are experiencing our highest census to date. In fact, over the past week, it has increased every day. We have a surge plan in place in the event we need to increase the normal capacity of our hospitals. We have not had to implement it yet, but given what we are seeing, I fully expect and anticipate having to implement that plan in the coming days. There is hope. We have vaccinated over 1,000, closer to 12 or 1,300 of our employees, staff, and physicians over the last few days with the Pfizer vaccine. And just today, we received over 1,000 doses of the Moderna vaccine, which we will begin to administer in the coming days. Soon, our hospitals will have their very own herd immunity to protect our workers from the COVID-19. The first doses have been given, and we'll continue to give those first doses over the next few weeks. And then in January, we will provide the second dose to those who received the first dose. And we will continue to support the county and other physician offices to administer the vaccine as quickly as we can. We are very fortunate that over the past several months we have been able to acquire and store sufficient personal protective equipment for our staff and physicians, such that we have a sufficient supply to continue protecting our employees and physicians and continue caring for our community. We are not experiencing a shortage of PPE at this time. Staffing is challenging, and what this is all about, what you're hearing about, asking you to social distance and wear a mask and wash your hands, is because as the coronavirus expands in our community, it also impacts healthcare workers, and they become more susceptible, and fewer workers are available to work in the hospitals if they are exposed to the virus. So that is a very important reason to practice these safe practices. We have excellent staff at our hospitals, nurses and physicians who provide excellent care. We have asked them to step up, and they have. Just this week, I was speaking with Maria. Maria is one of our environmental services workers who spends her days cleaning and sanitizing the hospital so the virus will not spread. She was scheduled to be off this week, but when she heard there was a need in the hospital, she volunteered to come in and work extra shifts to help carry the burden that our healthcare heroes face each day. Thank you, Maria. We also have travel nurses and other staff that we have contracted with to come in and help support the efforts to care for our community, and they too are excellent healthcare providers. We talk a lot about what we should not be doing during this time. Let me take a moment and share a few things about what we should be doing. I too am a father. I have 4 kids at home, and so we are challenged with homeschool and keeping them busy. So let me share by example how to help manage your kids. I hope Mason is watching. Mason, clean your room. I know it's 1:30. Don't pretend you have. I know that your brothers and sisters, Spencer and Hunter and Addison, they've cleaned their room by now. I know you haven't. So clean your room. Keep your children busy. There's all kinds of chores that can be done. Teach them the value of work, of working together, planting a garden, taking care of the yard, all kinds of things they can do during this time of the pandemic when we need to be outside, social distancing. We can still remain active. We can still enjoy our time. We do not need to be bored at this time. These are great opportunities for families to be together in their immediate families and do things together and help the time pass. Finally, I will also encourage you to be safe. We have great resources and teams in place to care for you. If you need care and it's an emergency, please do not delay care. That will only make things worse. Go to the nearest hospital to get the care that you need. Each of the hospitals in this county has excellent staff in place to care for you. But we also ask you to do your part by continuing to social distance, wear a mask, and wash your hands frequently. I hope that we can all have a safe and Merry Christmas and a Happy New Year. Together we will get through this. Thank you. At this time, I'd like to invite Barry Zimmerman of County Health to speak to us.
Thank you, Darren, for your comments and for your advice to all of us. I'm going to give a brief status update on our testing. As you know, testing volumes have been high, and we encourage that. Our goal with testing is to provide as much access and opportunity for individuals to seek and acquire a test when they can. As I've reported earlier, though, there are some consequences and issues we've had to work through, one with the supply lines, and so as well as weather does impact our outdoor operations. Due to that, some of the scheduling has been variable, and when sites are open and when they have to close changes. So we encourage everyone to take advantage of the information we post on our county website at Ventura County recovers.org. There is a testing section there that will list the latest status of all our testing sites, and hope you take advantage of that. As of this morning, all our sites were open and operating. However, throughout the day, many of you are aware of the high winds that we have been experiencing. So we've had to close due to weather 3 of our sites, the Moore Park location, the Santa Paula location, and the Oxnard pop-up location at the Oxnard Housing Authority. In addition, since demand is high, oftentimes wait times and lines grow in anticipation of being serviced with the test. We are aware of that, and we make a conscious effort that individuals will not get in a line and come to an opportunity where they cannot get a test. So oftentimes we have to close early the testing sites based on the line that exists. For example, at Kimball Park today, that testing site is a pop-up site at the park. The line is long enough that we can only service those that are currently in line, and we will have to cut off those who come and invite them to go to another testing site, or in this case, in a day or so when we open up after the holidays. So I apologize for those that come and we have to cut off those sites early because of the lines. We are trying to remedy that, and I will explain some of the solutions we are putting into place so we can have more throughput at each of our sites. First of all, we have entered in and have stood up a new laboratory that will supply us additional test kits and capacity to perform the tests so we can have more timely responses to those tests. The lab is known as Fulgent Genetics. They are a local Southland laboratory which will help us with our access and ability to get supplies. We rolled out that new lab with the setup of the Oxnard, not Oxnard, but the Camarillo location over this past weekend, and it was very successful with that. We experienced high volumes with that, but the operations and the lab was very successful in getting that set up and going. So we have now converted the Oxnard College site over to the Fulgent laboratory as well. And what that has done was allowed us to open up additional lanes so we can have more throughput at the Oxnard College from 3 lanes, and now we can expand up to 4, 5, and 6 lanes at this point in time. We will continue to augment our current testing sites with integrating the Fulgent lab into this to expand our total capacity and to guarantee a more steady supply line to all testing sites. The next site that we are going to convert to the Fulgent lab will be Moorpark College, and we will do that in the next coming days, and then hopefully have that open on the weekend and start with the Fulgent lab at Moorpark College as well. With the Fulgent sites coming up, I want to make you aware that we have a new procedure that we would like everyone to pre-register online prior to them going to the location. This will streamline the process and make it more efficient for you to enter in, get your test, and to exit the location in a more rapid fashion. You can go to a website, it's known as vccovid.com, and that's a site you're able to do the pre-registration and also identify the site you are going to. That sets you up to receive the test that day. It is not necessarily a specific appointment time, but it is an indication that you pre-registered for that site for that day, and you'll be able to then more rapidly move through the testing site with that pre-registration. If you're unable to pre-register for any means, you can still go to the site and we are able to register you on site. We would prefer to pre-register as it makes the process more streamlined. Also at this time, the pre-registration is being built into multiple languages. At this time, it is only in English, and we do have those that may be limited English speaking. We have staff on site to assist you in that registration process. We anticipate that with the inclusion of the Fulgent lab as well as the LGT labs, that we will be able to catch up with the testing capacity, and the lab work will be more timely in the week to come, where we'll more traditionally receive our results within a couple days. Currently, we have a backlog of testing results and has lagged in our result notification time frame. To just give you an idea of the volume of testing that occurs, I know Rigo reported about 700 per 100,000. What that means is, for example, at Moorpark College yesterday, we had 1,883 individuals come through that site. And that is on the high side, but typical for that location. The volumes are high, and we are working every way we can to increase the capacity and reduce your wait time, because our goal is to allow open access to testing. To understand the commitment that the county's made towards that, on average, we spend about $1.5 to $2 million to secure testing capacity on a weekly basis. That's not an insignificant amount of funding or volume that occurs, but we feel it important to find methods that we can provide this testing to all residents who desire and not limit that. So let me remind you, for the sites of Camarillo, Oxnard College, and soon Moorpark College, to please go to vccovid.com to pre-register for those testing locations and the day you want to go in order to accelerate the process through. We will also like to notify that we will be changing and moving the Santa Paula site from the Oil Museum parking lot in the weeks to come, and after the holiday, we'll be moving to Harding Park there in Santa Paula to allow greater capacity and less impact onto the community as far as traffic goes. So there's going to be a lot of changes, and as the weather and wind events come, we have to be mindful of safely operating an outdoor operation during those weather events, and so at times we have to close those down. I would encourage that you do follow along and check the status of each testing site at Ventura County Recovers.org under the testing section, and that will be updated throughout the day to keep you apprised of how testing's going. So that concludes my remarks today, and now I'll turn the time over to our CEO, Mr. Mike Powers.
Thank you, Barry, and good afternoon. Just stunning numbers that we've heard today from Mr. Vargas, the projection that at this rate we could have over 600, possibly 660 hospitalized patients in a month. And just to put that in perspective again, our surge over the summer was at 100. Now we're at about 330. This would put us at twice that volume. And we're sharing that because we want you to know, and as a community, we know you want to know where we're at, where we're headed, and so forth. So we just want to level with you and say, there it is. You've heard what that impact will be to our hospitals. On the plus side, we so appreciate hearing from Darren Lee from Dignity St. John's and Pleasant Valley today, because I can tell you I'm on these calls, and Darren and the other hospital leaders in this county are doing an amazing job of managing this incredible increase in volume. And continuing to provide safe care with the talented, dedicated staff that they have. But they can't keep it up at this rate, right? It can't be sustained, and that's the challenge. And we hear from Dr. Shore, what a great example of, for all of us to remember what it's like on the front lines. And as COVID spreads in our community, health providers are just like anyone in our community. More of them are getting positive as well, and therefore can't come to work, and that puts even further strain on our wonderful dedicated staff. And just as I know many health providers in our community, these jobs, it's all consuming. They are completely dedicated to their patients. They give everything that they have, every shift to every patient, and it takes a lot out of them. And you can hear that with Dr. Shore, how much it's taking out of her and her colleagues to try to sustain at this level. And then when they hear this high volume that they could even go higher, then you see the sense of desperation that has. And so we are such a compassionate community here in our county, and I just urge all of us, as we're thinking about any actions that we take going forward, to remember those brave healthcare providers, totally committed every day, taking care of our community members and our loved ones, our nurses, our doctors, our respiratory therapists, our housekeepers and dietitians, the whole team. It's an amazing group of people who are caring for our community. We're also hearing just to go back real quick, your community has stepped up again. What are some of the things you can do? You can get tested, right? Well, you're doing that, and we really appreciate it. You saw that number that Mr. Vargas showed earlier, total number of tests in our community, about 630,000 or so. That is truly remarkable, and that speaks to you, the community, caring and doing what you can to try to stem the spread, and we thank you for doing that. Other signs of good things happening is the vaccines and the vaccinations that are happening at the hospital. I understand from talking to EMS and hospital leadership that they will be done with their first rounds of vaccinating by this weekend. And that is really an amazing accomplishment. Over 10,000 vaccinations will have been conducted. And we're also hearing that there have been so far as we know, reported allergic reactions. So really great things happening on that front. A long way to go, months to go, but so far, so good. And that's exciting to hear. And also we're going to have, I believe it's starting in the next week or so, our first drive-up vaccination clinic for first responders and healthcare providers. So more and more the delivery and administration system is going to expand for our first responders and our healthcare providers and our long-term care facilities. So good things are happening on that front. We've touched on resources just a bit here today, and I did want to just share with your folks, with the community, how the funding is being spent. You can see in this chart, I think it spells it out. We received over $200 million in different types of federal funds that we've drawn down here. But it's been very important to our board and our county leadership that we get this money out into the community. And we're very pleased to report that 91% of those funds have been distributed out into the community, with only 9% used to support county efforts in terms of response. And you can see what it's been used for senior nutrition business assistance, rental assistance program, farm worker housing assistance, supporting our hospitals, our cities, and our homeless and other vulnerable populations. Our testing at the rate, you heard Mr. Zimmerman reference it, up to almost $2 million a week, but that's critical that we have that. And we know that there's a bill in discussion in D.C., and that we're eager for that to happen because it's going to help so many also of the unemployed in our community and those businesses who've been hit hardest by the closures. So we're eager to see that get passed. You may note in there that there is no, right now in this bill, any funding dedicated to local governments, but we just want you to know with our board's careful budgeting, we have set aside money to support business assistance and rental assistance program in the January-February timeframe. So we will continue to move forward with that. I do want us to continue to, as we talk about keeping our healthcare providers and those patients forefront in our mind, also remembering that this is an economic crisis and hardship as well. And so many businesses and their employees are suffering or lost jobs. And so we're working on it in multiple ways. The state has some new programs. Really encourage you to contact EDC, the Economic Development Collaborative. They are just a great source to help translate how does that great state program actually help me here locally in my business. Restaurants, we know restaurants are hurting so much, and they've done such a great job, like all our businesses, of complying. And we've had a Great Plates program, which is a federal program where we work with restaurants to feed homebound seniors and other folks in need. And that's helped many of the restaurants, and we're actually working to expand that now. We're going to get another 30 or 35 or so restaurants in there. So we're just any way we can to support our businesses. And during this holiday time, again, I know we've said it before, but please shop local. Any way you can. You can still go in. There's limited capacity in our local retail stores, but they're also set up online, our local shops too. So please take advantage of that. Get gift certificates, anything you can do to support our local businesses here. And we've talked about this beautiful community spirit we have here in Ventura County, and just one example of it. We know our Area Agency on Aging at Ventura County. They have a great program to feed the seniors, as I just alluded to, but during the holidays, it can be a challenge for folks to come and get the food. So our own public information officer, Ashley Bautista, put out a call to some community folks to see if they could help deliver those meals over the coming holiday. And just in a day or two, she received 165 responses for people who are eager to go bring those meals to our seniors who are isolating at home. So lots of wonderful community spirit out there. We thank you for what you're doing. And just so you know, just to put all those meals in perspective now, there's been just about 2.9 million meals provided to our seniors in our community through these programs. So that's a lot, but we're going to need more, and we thank your community for helping out with that in so many ways. Lastly, I would just say, if we've heard from our eloquent speakers today about the strain on our hospitals, and I just would go back again to try to, as we go through this holiday season, to keep them at the forefront of our mind. And many of the providers have shared this image with us, And I think you can see that really expresses a lot of how many of them are feeling, that they are truly straining with everything they've got to take care of those very sick COVID patients in our hospital, our loved ones, our community members. We're deeply grateful to them, and we'll do everything we can to support them. And we just thank the community for doing everything you can to support our healthcare systems, our providers. And just as we go into the holidays, and to quote Supervisor Parks again, we're wishing you a safe and healthy and merry little Christmas. Thank you, and take care.